Dear students and my teacher friends, Namaskar. I welcome you to the presentation lecture on rheumatoid arthritis. So today in this lecture we are discussing about rheumatoid arthritis. So today we will discuss why rheumatoid arthritis develops in patients joint, what are the reasons, what are the causes, why this disorder occurs in the joint, and then how this rheumatoid arthritis affect the lifestyle of the patient, that we are going to discuss. And finally we will discuss about the treatments which are available for the curing of rheumatoid arthritis. So all this point we are going to discuss. Now first of all, see, the spelling is RHEUMATOID, arthritis. So we should not pronounce this as rheumatoid arthritis, but instead we should pronounce as rheumatoid arthritis. Rheumatoid arthritis is a chronic means meaning of chronic, adjective use about a disease or problem that continues for a longer time. So when the disease is very old one, that time the term chronic is used. So rheumatoid arthritis is a chronic inflammation means the swelling of the joint. So rheumatoid arthritis is a once again chronic inflammatory disorder, and usually this disorder arises between the ages of 30 to 50. But it is not that the person having age of 30 to 50 are going to affected. This disorder can occur at any age, and rheumatoid arthritis affects 3 times more women when we compare this disorder with the men. So women are more affected, 3 times they are affected when we compare them with the men. Rheumatoid arthritis not as common as osteoarthritis. So we can say osteoarthritis is more common. Osteoarthritis affects the joint more, and rheumatoid arthritis is the cases of rheumatoid arthritis somewhat lesser than the osteoarthritis. Rheumatoid arthritis affects millions, so worldwide lakhs of people they are affected by rheumatoid arthritis. About 1% of people, that means worldwide the total population, the 1% of total population worldwide is affected by rheumatoid arthritis. Now second point, now in the early stage of rheumatoid arthritis, so when rheumatoid arthritis begin, when it start, joint tenderness is observed. Tenderness means sensitivity to pain, okay, or the soreness. So in the beginning of rheumatoid arthritis, patient they experience pain in the joint, then the joint become stiffness in the joint. That means patient is not able to perform proper movement of the joint, that is known as stiffness. Okay, the joints become very rigid, joint become immovable. That is the meaning of stiffness. So in the early stage of rheumatoid arthritis, joint tenderness and stiffness are observed. Tenderness and stiffness are very common. Many joints, particularly the small joint of the body, finger joints, wrist joint, ankle joint, and joints of feet, are affected by rheumatoid arthritis. And this rheumatoid arthritis affect the joint at the same time and bilaterally. Same time and bilaterally meaning, for example, if the right elbow joint is affected by rheumatoid arthritis, so most likely the left elbow joint is also going to be affected by rheumatoid arthritis. The course of RA is variable. So in variable degree, this rheumatoid arthritis affect the joint, and this disorder is marked by flare-ups. Flare-ups meaning a sudden outburst of something, especially violence or hostility. So here sudden outburst of something, that means the uh, the problems in the joint, they develop very fast. So patient complain that the joint is paining very quickly. So and patient also complain that the joints are becoming the stiff. He is not able to move the joint, and all these changes, they occur very fast. Okay, that is the meaning of flare up. And Ramazan. Ramazans mean susceptible to change. Okay, so the condition or the structure of the joint changes. Okay, then rheumatoid arthritis patient, they complain about the pain in the joint, then swelling is there. Along with this, some other manifestation are also observed. So rheumatoid arthritis patient, they also suffer from anemia, then they suffer from osteoporosis, muscle become weak, and cardiovascular problems are also observed. That means the circulatory system, the heart is also not working properly in rheumatoid arthritis patient. Now the third point. Now, rheumatoid arthritis is an autoimmune disease, a disorder in which the body's immune system attacks its own tissue. So, what happens in rheumatoid arthritis? Patient's immune system attacks patient's body tissue. This is what going on in rheumatoid arthritis. Now, why this rheumatoid arthritis originate? How this disorder start? How this development of arthritis occur? So the initial trigger for this disorder is unknown, okay, but it is expected that it is assumed that various bacteria and virus infection are responsible for the development of the rheumatoid arthritis. Now, perhaps this microorganism, they bear molecules similar to some naturally present in the joint, possibly glycose aminoglycan. So in the very beginning of rheumatoid arthritis, in the early stage development of rheumatoid arthritis, what happened? The patient's body is attacked by bacteria and viruses. Bacteria and viruses are microorganisms And this microorganism, they are having molecules, and these molecules are similar to naturally some natural molecules. So that means this natural molecule are glycose aminoglycan are actually complex carbohydrates. So bacteria and virus, they are also having this complex carbohydrate in their body. Okay. And in our body, so in our body, in patient body, cartilage is having glycosaminoglycan, then joint fluid is having glycosaminoglycan, and some other connective tissues are also having this glycosaminoglycan. So as now you can understand, in patient body, the complex carbohydrate proportion increases, the amount of glycosaminoglycan increases, because bacteria and viruses which are impacting the body are also having this glycosaminoglycan. So the patient's immune system activated, patient's immune system become active, and this immune system attempts to destroy both. So patient's immune system destroys, try to destroy glycosaminoglycan of bacteria and viruses, and also which is present in cartilage, joint fluid, and other connective tissue. So this is the reason uh, why this rheumatoid arthritis disorder initiate. Okay. Now, rheumatoid arthritis begins with the inflammation of the synovial membrane. So, firstly, what happened? The synovial membrane inflammation means it gets swollen up. Okay, so synovial membrane swell up of the affected joint. So, in the joint, synovial membrane swell up. Now, due to this inflammation, due to this swelling, the inflammatory cells, lymphocyte, and especially the macrophages and some other cell, this inflammatory cell from the patient's blood, they come out, and all the cell, lymphocyte and macrophages and other cell, they migrate into the joint cavity, and this cell, lymphocyte and macrophages, unleash a deluge of inflammatory chemical. Deluge means immediately they are releasing large amount of inflammatory chemicals. So inflammatory cell, they releases inflammatory chemical, and this chemical destroy body tissue when releasing large amount. So how the development of rheumatoid arthritis begin? Firstly, synovial membrane inflammation is there. So from the blood, inflammatory cells, they come out, they ooze out from the blood, and these cells, lymphocyte and macrophages, they migrate into the joint cavity. Now the cell releases inflammatory chemical, and this chemical destroy body tissues. Synovial fluid accumulate in the joint, and as the synovial fluid is accumulating in the joint cavity, so what happened, this causes joint swelling, so the joint becomes swell, and in time inflamed synovial membrane thickens. Along with this, what is happening, the inflamed synovial membrane becomes thick, and this inflamed thick synovial membrane is known as pannus. Okay, so thick inflamed synovial membrane known as pannus or rag. So what is this pannus or rag? So pannus or rag, an abnormal tissue that clinge to the articular cartilage. Clinge means cling means to stick firmly. So the pannus or rag, abnormal tissue, stick to the articular cartilage very strongly. So in the figure, let me show you this. So over here in this figure, here you see this is the pannus. Okay, then in this figure, see normal joint left hand side, and on right hand side joint affected by rheumatoid arthritis. So here you can see in figure B, pannus is shown. Okay, then once again in this figure, see normal joint and joint affected by rheumatoid arthritis. So we had discussed about how the pannus develop, and this pannus cling to the articular cartilage. Now this pannus erodes the cartilage. It removes, it breaks the cartilage. Eroding means, so pannus is destroying the cartilage, and sometimes the pannus also erode the underlying bone. So just beneath the cartilage, the bone which is present is also affected by the pannus. So eventually scar tissue is formed, and this scar tissue connect the bone ends. So normally at the joint we know that two bone ends are there, and as the scar tissue develop from the pannus, so this scar tissue joins the bone ends. Now over a period of time, this scar tissue ossifies. That means the slowly this scar tissue is converted into the bone. So now you can understand what is happening. The bone end, between the bone end, the scar tissue is ossifying. That means a small bone is produced which is newly formed, and this newly formed scar tissue which has ossified, it joins the bone ends. So now bone ends fuse together, and as the bone ends fuse together, the joint immobilize. So the patient is not able to make a movement of the joint. So this final condition, where the joints, where the bone ends fuse together, patient is not able to move his joint, this final condition is known as ankylosing. Ankylosing means stiff condition, very rigid condition, immovable condition. And this ankylosing often produces bent, deformed fingers. So the orientation of finger, the arrangement of finger is affected. They are not properly aligned. Their position changes. Okay. Now, not all cases of rheumatoid arthritis progress to the severely crippling alcosis stage. So it is not that the any kind of rheumatoid arthritis is going to be converted into this final ankylosing. Here let me put N. Okay, there is a ankylosis. Okay, ankylosing. But all cases do involve restriction of joint movement and extreme pain. So whoever the person is, the joints which are affected by rheumatoid arthritis, so the person is not able to move his joint, and he is also experiencing the severe pain in the joint. So in the fourth point, we have discussed how exactly the rheumatoid arthritis develops. Okay. Now in the fifth point, we are discussing about the treatment of rheumatoid arthritis. Now the goal of current RA treatment is to go beyond simply alleviating the symptoms. Alleviating means to make something less strong or bad. To make something less strong or bad, that is the meaning of alleviating. So scientists and the researchers, they are not interested into reducing the symptoms of the RA treatment, but they want to completely cure the rheumatoid arthritis. Okay, so that is the meaning of this thing. The goal of current RA treatment is to go beyond simply alleviating the symptoms, okay, and instead to disrupt the relentless destruction of the joint. So the whatever the problem the patient is experiencing, so the researchers and the doctors, they want to treat this disorder completely. For the treatment of rheumatoid arthritis, steroidal and non-steroidal anti-inflammatory drugs are used, and these drugs decrease pain and inflammation. So when the steroidal or non-steroidal drugs are used, pain decreases, swelling decreases, joint mobility increases. Now for the treatment, more powerful immunosuppressants are used. For example, methotrexate is used, and this immunosuppressant such as methotrexate, they act to slow the autoimmune reaction. Along with this, several biological agents are available which block the action of inflammatory chemicals. Now, an important target of some of this agent is an inflammatory chemical known as tumor necrosis factor. So there are several agents which target tumor necrosis factor. Okay. Now together these drugs can dramatically slow the course of RA. So the patient get relief from the pain when these drugs are used. And for the final treatment, as a last resort, replacing the joint with a joint prosthesis. So if the joints are severely affected by rheumatoid arthritis, that time joint prosthesis is performed. which is artificial joint. So joint replacement is performed on the patient. So the normal function of the joint can be restored. Indeed, some rheumatoid arthritis sufferers have over a dozen artificial joint. So some of the rheumatoid arthritis patients, they are having more than 12 artificial joints in their body. So as many as 12 or a dozen joints are replaced. So in the fifth point, we had discussed about the treatment of rheumatoid arthritis. Now I am showing you few photographs. So here you can see the lady is suffering from rheumatoid arthritis, swollen, painful joint, inflamed joint lining. Now here also in this photograph, see thickened synovial membrane, large amount of synovial fluid is there, cartilage degenerate. Here in this figure, comparison of normal joint, osteoarthritis and rheumatoid arthritis. Okay. And we have already seen this figure. Okay. Rheumatoid arthritis, figure A, severe case with a ankylosing of the joint, and figure B, X-ray of severe rheumatoid arthritis of the hand. You can go through this information regarding rheumatoid arthritis. Here in figure B, see rheumatoid arthritis. Note the mark ulnar deviation of the finger. So finger, they are deviating from their normal position. So with this, we have completed our discussion on rheumatoid arthritis. I hope you have enjoyed this presentation lecture, and I also hope that this presentation lecture will be helpful in your exam preparation and also in your studies. My name is Manish Koshti sir. I am from Ahmedabad, India. Bye bye. Namaste.